Hello, it's Peter Wright and Kathleen Beauvais with another weekly wrap-up for the Yakking Show, and this is for the week ending 13th of September 2024. So, welcome, Kathleen. How are you today?
I'm doing great, Peter. Thank you. And thank you also very much for tuning into our show. We so appreciate having you. Peter, I want to talk about something that, it's something that is widely talked about, and that is strokes.
Mhm.
But not many people know what all the symptoms of strokes are or what a stroke actually is. And that's what I really want to talk to you about today. So, strokes can be divided into two main types, hemorrhagic and ischemic.
Mhm.
A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing a blood clot that compresses brain cells and disrupts the blood supply. It can be further classified into intracerebral hemorrhage and a subarachnoid hemorrhage. And then, of course, there's the ischemic strokes, which occurs when a blood vessel is blocked,
Mhm.
leading to insufficient blood flow to the brain cells. And ischemic strokes can be further classified into cerebral embolism and cerebral thrombosis. So there are
Ah,
9 key warning signs of a stroke, and you probably are familiar with a few of them, but some of them might surprise you. So memory loss and difficulty concentrating. So, this type of memory loss differs from dementia. It refers to sudden, brief episodes of amnesia that improve after a short while, indicating mild blood circulation issues in the brain. So, memory is the first. Second is dizziness and vertigo. So occasionally accompanied by headaches or sensation of heaviness in the head, along with the ringing sound in the ears.
mhm.
There's also twitching. This includes eyelid twitching, facial muscle contractions, and muscle tremors. Then there's numbness in the scalp and the extremities. So this includes temporary numbness in the fingers, and that they say is actually quite common. And then, of course, there's overall tremors, and this includes thumb shaking, occasional soreness in the ankles, and leg cramps during sleep. And then there's slowed speech and movement. So this may include aphasia and reduced responsiveness to instructions, uncontrollable drooling without apparent cause. And then there's mental fatigue, drowsiness, and abnormal blood pressure. So high blood pressure can lead to a stroke by rupturing blood vessels in the brain, while low blood pressure may prevent sufficient blood flow to the brain, potentially causing an ischemic stroke. And then they say persistent headaches is also another sign. So headaches that can change from intermittent to constant and accompanied by stiffness in the neck and possibly even nausea. So there are some recommended natural things that you can eat to help prevent strokes. And some of these might surprise you. So there's number one, they suggest garlic because garlic
Mm.
has detoxifying properties and helps to unclog blood vessels. And then there's onions, which are rich in flavonoids and they're anti-inflammatory. But other things include shiitake mushrooms, wheat, corn, brown rice, and green tea.
Mm.
So
Wow,
that's it.
there we go. Wow, I'm a bit worried because I think at times I've got probably more than half of those symptoms, right?
I know. Whenever we read something, we think, oh my God, I must have that, right? Because you
Right.
can kind of relate to some of the symptoms. But I guess overall, if you have more than just the one symptom, it might be cause for some concern.
Sure.
So the
Sure.
other thing I
Sure.
wanted to promote today is, of course, another Dr. Morse product, which today I want to talk about my well-loved product, the Ultimate Salve. I broke the lid off this one, but it's almost done.
Oh
But
yeah.
don't worries, I have another one. So they've changed the labeling slightly, but it's exactly the same product. And right now, Peter, I have bug bites that I have,
Hmm.
and they became infected.
Oh, look at that.
I know,
Yeah.
and I've been applying this Ultimate Salve, and I tell you, it is so soothing. and it is healing these very, very quickly. So it's a high quality blend of organic, nourishing oils and top quality herbs. And it has golden seal root, burdock leaf, aloe vera, cat's claw bark, astragalus root. It's just fantastic for any skin irritations and expedites wound healing. So
Very
a
good.
little plug for Ultimate Salve.
Yeah. Well, your arm's looking a lot better than it did yesterday, so it must
I
be
know.
working. Yeah,
It
big
is working.
improvement, eh? Big
Absolutely.
improvement.
Yeah.
Yeah.
So that's my bit,
Uh,
Peter.
well, when I'm a bit worried about those bug bites, I'm not going to come see you in a hurry. I don't want to end up with something similar. So, well, that was Kathleen's deep dive into strokes this week, and there'll be something else coming up for next week. So let's tell you what's been happening on the show in this past week. Well, on Tuesday, our guest was on his second visit to our show was DJ Kadagian, who's an author, a playwright, a filmmaker, really well accomplished guy. But he was talking about near-death experiences, right? And he had some quite amazing stories to tell. And the important thing with him, unlike a lot of other people, is that when he talks about near-death experience, this is a well-documented experience. Normally in a hospital, I think exclusively in hospital settings where people have died on the operating table and have been verified dead and have, after minutes or a few minutes, or in some cases many minutes, have come back after being kept alive by machines. And the stories they relate, many of them are verified by the doctors who can't believe what these people tell them when they were effectively dead and they were hearing what was going on in the operating theater.
And
It's uncanny.
what's important also to point out is that these people would have surely died had it not
Oh yes,
been for medical intervention.
absolutely. Oh yes. Oh yeah, no question. No question. So that's a really interesting episode coming up. And then Joy Musacchio, who's an aromatherapist, coming up the following week. And she has got a really interesting story about the importance and the different types of essential oils that you can be used in aromatherapy. And she's really knowledgeable. She goes into great detail on that subject. So then, of course, we have Jeff Nelligan, who comes on the following week, and he talks about parenting, particularly raising resilient children. And of course, for an old school guy like me, brought up in a different part of the world where things were conservative and much more rugged, he was singing from the same hymn book because I really enjoyed what he had to say. Then following that, we will have Dr. Tom Ingenio, who is expert on cupping, the ancient art of cupping. And then the week after that is Alan Meisner on the importance of exercise and keeping fit once you are past 40. So that's who we've got coming up on the Yakking Show. Our featured author for the week, of course, is DJ Kadagian, who was the guest on Tuesday with his book, Crossover Experience. And that details 100 near-death experiences, as I've just mentioned before, well documented and uncanny reading. It's quite incredible. That's it from what's been happening on the Yakking Show. As you can see, we have a very interesting lineup of guests coming along for you. So to make sure you don't miss out on these guests, hop onto the website, theyakkingshow.com, and sign up for our newsletter. We'll only send you one email a week. I'm not going to overload you. We'll just tell you who's on this week and who's coming next week. And I think that's it from me, Kathleen. So thanks, everyone, for watching and listening. Back to you.
Thank you, everybody, for tuning in. If anyone is interested in being a guest on our show, we're always looking for experts in any area of holistic medicine. And if that includes you, we'd love to hear from you. All you need to do is access our website at theyakkingshow.com, click on the contacts tab, and complete a short application form. We'd love to hear from you. So until next week, take care, everyone. Bye-bye.